we're showing up. It's all about us. And it's in the camera view, okay, with your beautiful sound. All right, welcome. Welcome. Get out my ear.
Hi, testing, 1, 2, 3. How y'all doing this morning? Good. All right, I can't hear you. How you doing this morning? Good morning. My name is Erica, and I am a union organizer with SEIU Wisconsin. All right, let's make some noise for the people that showed up today. So to give us a test run, when I say, what do we want? You say health care for all. What do we want? Health care for all. What do we want? Health care for all. When do we want it? Now. That's right. Y'all do that. Okay, now good morning. All right. What do we want? Health care for all. What do we want? Health care for all. And when do we want it? Now. When do we want it? Now. That's right. Make some noise, everybody. That's nice. That's nice. Let's wake the neighborhood up, okay?
She's ready.
Another one is keep us healthy, keep us strong, extend the credits now. And we'll say that 3 times in a row, okay? So it's keep us healthy, keep us strong, extend the credits now.
Keep us healthy, keep us strong, extend the credits now. Keep us healthy, keep us strong, extend the credits now. Keep us healthy, keep us strong, extend the credits now.
And what do we want?
Healthcare.
And when do we want it?
Now.
What do we want?
Healthcare.
And when do we want it?
Now.
All right. I like that. Okay, so the next one it says, don't take our care away. Extend the ACA credit today. All right? So that one goes with the keep us healthy, keep us strong, okay? So we're going to remix that up a little bit. We'll just use the energy to go with the flow. All right. Keep us healthy, keep us strong. Extend the credit now.
Keep us healthy, keep us
Okay, we can always remix it now. Okay. Don't take our care away.
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 Extend the ACA credit today.
Extend the ACA credit today.
Don't take our care away.
Don't take our care away.
Extend the ACA credit today.
Extend the ACA credit today.
Okay, y'all got that now. One band, one song, right? All right. What do we want?
Healthcare.
And when do we want it?
Now.
What do we want?
Healthcare.
And when do we want it?
Now.
If we don't get it,
Shut it down.
if we don't get it,
Shut it down.
if we don't get it,
Shut it down.
if we don't get it.
Shut it down.
All right, y'all sound beautiful out here today. Make some noise for yourselves. Keep us healthy. Extend the credit now. Y'all like that remix?
Whenever we're ready, somebody just let me know. Have we gotten to that point yet? No? Just keep dancing.
All right, keep us healthy.
Keep us strong.
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 What do we want?
Healthcare.
And when do we want it?
Now.
What do we want?
Healthcare.
And when do we want it?
Now.
And if we don't get it,
Shut it down.
if we don't get it,
Shut it down.
if we don't get it,
Shut it down.
make some noise. I like that. Y'all sounded great. Let's go. Let's keep the momentum going. Don't take our care away. Extend the ACA today.
Don't take our care away. Extend the ACA today.
That was a mouthful, right? Let's break that down a little bit. When I say don't take our care away, what do you say?
Extend the ACA. Extend the ACA.
All right. Don't take our care away.
Extend the ACA.
Today.
Today.
That's right.
Why? Because they got the whole government shut down, right? And they talking about our health care, right? So don't take our care away.
Extend the ACA.
Don't take our care away.
Extend the ACA.
Don't take our care away.
Extend the ACA.
That's right. What do we want?
Healthcare.
And when do we want it?
Now.
What do we want?
Healthcare.
And when do we want it?
Now.
If we don't get it,
Shut it down.
if we don't get it,
Shut it down.
if we don't get it,
Shut it down.
say shut it down,
Shut it down.
shut it down,
Shut it down.
shut it down.
Shut it down.
What do we want?
Healthcare.
And when do we want it?
Now.
What do we want?
Healthcare.
And when do we want it?
Now.
If we don't get it,
Shut it down.
if we don't get it,
Shut it down.
if we don't get it.
Shut it down.
When I say don't take our care away, you say extend the ACA credit today.
That's okay. I'll train to work like this. I'm getting leaders trying to this too, because I'm about to get old too. I'm trying to get away from the season.
What do we want? And when do we want it? If we don't get it, if we don't get it, if we don't get it, when I say don't take our care away, that's right. Milwaukee and Wisconsin.
Good morning, everybody. You know we're here to sound the alarm.
Yes. Yeah.
There's too many of us who are not understanding what's about to happen to us if we don't stand up.
Yeah.
Trillions are given to the rich while the poor continue to be neglected.
Yeah.
It's all hands on deck now. Black, white, red, yellow, brown. We can't be divided right now. We got to stand up for what's right, and we got to stand up together. We can't have people out here standing by themselves, struggling to get people to understand. We need the masses to share information with one another so we can do the right thing together. You cannot be afraid. You have to stand up. You can't let people keep rolling over you. The first thing we need to do is stand up. So when the steamrollers come, you can at least get out the way. We have to, we must look out for our brothers and sisters. Because a lot of people really are not aware what is going to happen to them. We are so blinded by rhetoric. That's why we have to be truth tellers. And the first truth I'm going to tell is this. We're having a government shutdown. And some people say it's because we are giving free health care to immigrants. I don't think that's true. We're having a shutdown because some people are standing up for the fact that we cannot dissolve Affordable Care Act. We can't take away those premium tax credits. Because if we do, millions of people will be in peril. Millions of people will die because they don't have any insurance. We cannot stand around and watch our folks just dissolve. Stand up. We got to stand up. Listen. Stop letting others divide us. That rhetoric is tired. We don't talk to each other. We got to stop that. Because we got a whole lot of things in common. And we can afford to not communicate with one another, especially now. Because the fight is just beginning. And you got to have a stomach for the fight. You can't be standing around waiting for somebody else to fight. You have to get out and walk beside us and fight. We have to fight together. Don't send me out there and when I get finished, you tell me, good job. We're behind you. No, I want you with me. I want you walking with me. No one can do this alone. And we're all out here today because we care. Freedom, our rights are certainly at stake right now. I'm talking about health care right now. But it'll be something else tomorrow. If we don't stand up right now, everything that we've accomplished in this country will be dissolved. We got to stand up and we can fight this right now. You can call the people who represent you in Congress and in the Senate. You can call them right now and you can demand that they make sure that we all have the right to fair health care coverage. Listen, I'm not alone today. As a matter of fact, I have a champion that I just think can't be beat. This is a woman who looks out for everyone. It isn't just a few. It isn't just, black or white. It isn't just brown. It isn't just yellow. It isn't just red. But she looks out for everyone. And she is so dynamic. And she is so strong. And we love her because she is standing in the gap for all of us who just don't know where to stand. And she's going to talk to us today about what's really going on. Where is she? Representative Gwen Moore.
I love you back. I was just thinking I should have brought my bullhorn because I certainly don't have the lungs that I have heard here. But I really don't know where to start. I think the appropriate place to start is to thank each and every one of you within the sound of my voice for sticking up. Thank you. Thank you for sticking up for Democrats who are not capitulating to Donald Trump.
That's right. Yes.
In the legislative process, it's necessary to compromise. But they're not asking us to compromise. They're asking us to capitulate. They're asking us to allow 15 million people plus, and I'll get to the plus part in a minute, to lose their health care. I heard Reverend Lewis talk about the poor. But it's more than just the poor who are going to suffer under the dismantling of our health care system. Let me just give you a few facts. First of all, they cut over $1 trillion out of Medicaid. And you think of Medicaid as a program for the poor, but I want to be clear about something. 46% of Medicaid is spent on people in nursing homes. That's my Joe grandmother. 46%, and that's mandatory spending. So that means every other expenditure for Medicaid, which includes giving people rides to dialysis, which includes allowing people to stay in their homes and have home health care, which includes payments to hospitals for behavioral and mental health for children, includes monies to community health centers. All of this is at risk. And our state legislators are going to have a really hard time trying to figure out what to cut out of the balance that is left after the $1 trillion is gone. Not only that, $500 billion in Medicare is being cut. Medicare. Come on now, I see a lot of gray heads around. I see this gray beard here. You don't look too happy. $500 billion in Medicare is being cut. And you heard Reverend Greg talk about the ACA premiums. Those are premiums that have enabled people. These are not, as you have heard, incels, boys in the basement playing their video games, calling up the steps, asking their mom to bring them some more potato chips. These are people who, say for example, people who worked at J.C. Penney's as a photographer and decided that they were good enough to go out on their own. And so they were able to buy a silver plan from the ACA and to start taking pictures and bat mitzvahs and bar mitzvahs and weddings.
That's right.
These are people who now made be shut out of health care.
Wow.
Let me give you some
That's
examples.
not right.
I'm gonna give you some examples of Wisconsin's 4th Congressional District. This is Wisconsin's 4th Congressional District, in case you didn't know where you're standing right now. Say, for example, there's a 60-year-old couple, not old enough to receive Social Security yet. And maybe they are no longer working, but they were able to buy a silver plan through the ACA. Say they're still working and they're making $82,800 a year. Nice couple. They can afford to stop at George Webb's, one of our favorite places, half breakfast, without worrying. They're not poor, but their premiums with their silver plan, on top of whatever they're already paid, will go up by 238%. By $16,412 a year, or $1,068 a month. On top of what they're already paying.
Criminal.
Take a family of 4, earning $64,000. Their premiums will rise by 199%.
No.
An additional $2,571 a year. That's $214 a month more than they're already paying. So if they're paying $250 a month, just add $214 more dollars on top of that. So you see what I'm saying? I got lots of examples here, but the point is that either people will figure out how to come up with this money, not, or they simply won't have health care. Wow. Now, one of the arguments that's being made, we'll take some of these clothes off. One of the arguments that's being made is that why don't you guys just wait until November 21st? We can settle all this. I'm going to tell you, premiums for health care are going to hit mailboxes November 1. Wow! We can't wait, y'all! We can't wait! It may already be too late. Those executives have got to make decisions about premiums, and we had some executives come to my office in D.C. when the government opened and said that premiums will definitely go up by 75% at a minimum. And that's not just for poor people. That's not just for people who depend on the ACA. Oh no. Oh no. People in the private sector are going to soon hear from HR about how their share of their company premiums are going to go up. You've heard the lie about immigrants. Am I talking to them all? No. You heard the lie about illegal immigrants spending all our money on health care.
It's a lie.
That's a lie. Let me just tell you, current law says that anybody who shows up in an emergency room will be treated. Nobody's going to ask your immigration status. If you are in a car crash on I-94 and you have the helicopters, the Flight for Life takes you to Freighter, they're not going to stop and ask you if you are a citizen before they treat you. There is a teeny-weeny portion of state funds and federal funds that repay hospitals for uncompensated care for non-citizens who find themselves in that situation. That was not changed with the one big beautiful bounty for billionaires. That provision still exists. But what does not exist is Medicaid ACA credits, Medicare, Medicaid for undocumented immigrants. That is a lie. It's a lie before the big beautiful bill passed, and it's still a lie. What they did take away in the one big beautiful bill is for immigrants who were here under asylum to be eligible for the ACA credits and for Medicare. For people who were here legally, immigrants who were here legally have been stripped of their ability to receive health care. But never, 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 never were illegal, undocumented people eligible for Medicaid. Let me just tell you what's at stake. The Republicans have decided that they have Senate Democrats over a barrel. And it's a selfish choice, people. It's you either let us kick these 15 million people off health care, or we're going to shut the government down.
Wow.
And the president has continued to do what he's already done, and that's to fire people. And he is threatening to fire them so that they won't be able to come back and receive back benefits because they've been furloughed. I don't want to criticize. I refuse to criticize the couple of senators who have voted with the Republicans to keep the government open. Give me some grace. Just let me finish. Because it is very serious. It costs billions of dollars to shut the government down and then to reopen it again.
Wow. Yeah.
But at the same time, I want y'all to just give a shout out to those senators who are holding out. Because it's not just Medicare that's at risk. It's not just Medicare that is at risk. It is not just the Affordable Care Act that is at risk. It is not just 15 million people who are going to be thrown off health care that's at a risk. What is at risk is our entire medical framework. I've had visits from all of our major hospitals. They're closing down hospital wards, closing down certain hospitals. Rural areas, they're completely closing the entire hospital. Hospitals will pay an average of $25 billion a year in uncompensated care and losses. Our community health centers, you remember at the beginning of this, when Doge came in, the first people who had their departments closed for business were our community. What is at threat is our entire health care system.
Wow.
It's going to be on the verge of collapse. And so, no, they don't care.
They don't care.
They don't care because they have decided that it is more important to enrich billionaires than it is to take care of the rest of us. Don't believe it when they say that their bill is a middle class bill. If you get a $265 income tax refund based on their one big beautiful bill, ask me if that compensates for the $1,600 increase in your You know, at the appropriate time, I'll answer questions, but I'm going to yield back to Reverend Craig right now.
They don't care. 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 But somebody's got to care. Listen, I'm going to say this, and I say this all the time. The cavalry is not coming.
That's right.
We are the cavalry.
We are the cavalry.
The cavalry's not coming. to stand up and we can't be afraid.
Yes.
I keep saying that because you don't have anything to be afraid of when truth and justice is on your side. In saying that, I want to call my friend, the Vice President of Micah, Milwaukee Inner City Churches Allied for Hope,
All right.
Reverend Joe Jackson.
Let me make a correction. I am not the vice president.
Yeah, he's the president.
I'm the past president, but certainly I stand today on behalf of all of us and Micah, amen, on this crisp Saturday morning when we could be doing something else like sleeping in. But we're here today, and Congresswoman So shared that information with us exhaustively. I wonder what more can I say? But we are here in numbers, diverse races, diverse faces, and diverse social statuses, economic abilities. We're here in diverse faiths, denominations, and even those who claim no denominational or faith affiliation. We're here. We are here for the fight of our lives.
Fight of our lives.
And as the prophet told us already, we're not waiting for the Calvary. We are the Calvary. We are to make a strong statement is to leave our health care alone. In the gospel, amen, according to John, Jesus says that the thief comes to steal and to kill and to destroy. But he says, I came that they might have life and have it more abundantly in all of its fullness. I don't know about you, but abundant life translates for me that my Medicaid and my Medicare, amen, remains intact and not heavily hit. That my Medicaid costs don't go up to the extreme. And that the negotiable conversations on prescription drugs remains intact. Now, I'm almost done, but as one of my colleagues shared with me this week, and he's in the crowd, so he knows what he shared.
So is that easy?
He says, he says that Jesus healed regardless of social status, regardless of race, regardless of income, that all faith traditions uphold the value of health and healing for all who are in need. That millions of Americans face the dire prospect of losing their health insurance due to changes in Medicaid and the elimination of tax credits for Affordable Care Act coverage. So in closing, we need to stay the course. We need to push back. We need to keep resisting. We need to keep insisting. We need to keep persisting. As I heard the preacher who spoke, and I wasn't there, but I listened to his message. He spoke at the Congressional Black Congress, caucus, and he said, referring to our current administration, we may have been dealt a bad hand, but we got a good partner. We got a good partner. We got good partners. We have a good partner. If we work, somebody say if we work. If we work, I declare God will. He'll work it out. Won't he do it? Amen. Hey, listen. Our care. Our care. Our care.
So I want to acknowledge someone who's been a legend in our community for a long time, and hardly anybody understands what he does, because it's always been in the background, but it's always been very effective. We have a man here who helped the Affordable Care Act get across the line. Y'all don't know who that is, do you? I'm going to tell you right now. He's out there. Let me point to him. Bruce, raise your hand, man. Bruce Colbert. The legendary Bruce Colbert. Yeah, he helped the whole thing get across the line. And he was also adamant about us being here today. That's right. He was here at 8:30. He was. That Bruce is now that is a general. Listen, our last speaker from the NAACP is Mr. George Bledsoe. Come on up, Mr. Bledsoe.
Good morning, everyone. I bring greetings from the NAACP Milwaukee branch. I always have the honor and the privilege to serve as the first vice president. Can you all hear me? Yeah. Well, thank you so much again. My name is George Bledsoe. I have the honor and the privilege of serving as the first vice president of the NAACP Milwaukee branch. All right. Under President Clarence Nicholas. We are celebrating our 101st year this year. The NAACP branch has been around and active. We're still here and around. If I may do just a quick plug, we're actually having our Freedom Fund dinner next week, October the 17th. The theme is the fierce urgency of now. We'll have Ms. Karen Boykin Towns, our Vice Chair of the National Board of Directors, as our keynote speaker. Yeah. I was happy to be invited to come here to speak anytime Souls and Pulse and Reverend Greg Lewis mentioned. I'm all about it. I'm looking to be there. I always say to Mr. Lewis when I see him, there's the man that's going to keep us honest about this work. So I love it. I love it. And thank you so much for having me. Kind of a personal experience I've had in healthcare. Growing up in Tennessee on a farm in an urban area, not a lot of focus on healthcare. A lot of people just didn't go to the doctor. My mother was a nurse, so we always had access to healthcare. She always advocated, especially for my older relatives, that sort of thing. I remember my grandmother had contracted tuberculosis, and everyone in the home had to go and get treated. And I remember being a young person thinking to myself that this is kind of what healthcare is in this country. If we have access to it, everyone has access to it. Not knowing that wasn't the case. Moving on and moving up here from Tennessee, I went a brief period of time being out of my mother's home without health care. And then I got a job, and I had health care. So I thought that was just, kind of a little period of time that maybe everyone has to go through at some time. Not really knowing and appreciating that a lot of people just never even had health care, don't have access to that sort of thing. Moving along in my adult professional career, I've always had health care through jobs. Come around 2008 and Barack Obama getting elected, and I remember thinking to myself, is he really going to, spend all of his political capital on getting health care for everyone? Is that even possible? Is that something that, he should do? Not really knowing. Then comes along the financial crisis, and me working in financial services, I lost my job. And I did not have health care at that point anymore. And all the while, these things are going through legislation for the Affordable Care Act, and I'm paying particular attention because now I find myself with the majority of a lot of people that don't have health care. So that was kind of a unique experience. I remember the Affordable Care Act passing. I remember myself actually signing up and going through the exchanges to look at things, but just so happened a few months after that, I got a job and I had benefits again. So I was kind of back in the healthcare, the access to healthcare at least. So I say that because my experience was different. I didn't think of healthcare growing up as a kid because I always had it. Had it for so long through jobs, and then eventually knowing what it's like to lose healthcare and to be on the exchanges and looking and not making regular doctor's appointments, that sort of thing. I wanted to let you all know that the NAACP, national and local, is always involved with issues such as this in the Health Care Act. Just a few tidbits on a few things that the NAACP has been engaged on a national and local level that we continue to do as well. The NAACP has consistently supported the ACA, working to ensure its full implementation and opposing any efforts to repeal or weaken its provisions. This includes support for protections for people with pre-existing conditions and Medicaid expansion. The organization advocates for Medicaid expansion to close the healthcare coverage gap and reduce disparities, which disproportionately affect people of color in particular. They urge states to expand Medicaid and implement systems to prevent wrongful disenrollment. Just another tidbit as well is that the NAACP lobbies for legislative action to protect affordable health care. For example, they have urged senators to vote against funding bills that would threaten the ACA's tax credits, which could cause millions to lose coverage or face significantly higher premiums, which is kind of what kind of brings us here today. That sense of urgency. The NAACP conducts outreach and education to provide information about health care options, including using the health insurance marketplace to combat misinformation in the African American community. The NAACP's long-term goal is universal health care system that provides affordable, high-quality, and culturally competent care to everyone, regardless of their circumstances. So thank you so much for your time. I did want to bring the message that your NAACP is involved. I'm so happy to be here, and thank you all so much for your care.
Wait, hold on. Wow. There you go. Thank you, Mr. Bledsoe. So listen, now we got to understand that we got to stop letting things happen to us. We got to start making things happen for us.
Right, we can do it.
This is just the beginning. We got to keep the alarm sounding. I don't care who shows up, I'm showing up. I don't care how many people it is, I'm going to be here. I don't care who ain't with me, I'm coming if I have to come by myself. If I have to crawl and bite and scratch, I'm going to be holding on to what is mine. And I'm asking everyone, please be there with me. We cannot let these people keep doing to us anything they want to do. We have power. We should stand up. We have power and we have to use it. Stop thinking that you don't count, because right here, right now, you're probably the most important people in the world. Because you stand up. You don't lay down and get rolled over. Hands off healthcare! 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 All right!
What do we want? How do we want it? Now! What do we want? Healthcare! And when do we want it? Now! And if we don't get it, shut it down! If we don't get it, shut it down! If we don't get it,
there's any questions, I'm going to ask our precious Congresswoman to come and answer any questions you have from the press.
Any questions?
Come on, y'all. Y'all got some questions. Yo, one of the things that I just want to lift up is something that all of the speakers have talked about. I really appreciated the story from the vice chair of the NAACP in Milwaukee. Really sharing something personal. Because sometimes this seems so abstract to people, you know, to put a face on the problem. One of the things that I want to lift up, that Reverend Lewis has talked about, that this is not just, this is about all of us.
All of us.
Even those of us who, you know, the 60% of us, 65% of us who have health care through our jobs. Your premiums are going to go up, people.
Wow.
It already has. It already has gone up, and it will go up. It already will, because there's no way in the world that a health care, that health insurers can afford to see $1 million taken out of Medicaid, because that's a big share. I talked to one person who was the president of a children's hospital, not the children's hospital here, but in another state. He said 90% of their income came from Medicaid. So what do? What they do is that they cost shift, and people who have health care have got to pay so they can keep their doors open. Wow. So for those of you who feel like that, you know, hey, this, you know, I already got a job, I'm safe. You know, there's not going to be a financial crisis. I'm not going to lose my job. It doesn't affect me. Your health care premium at your good paying job is going to go up. Wow.
It's healthcare or food. People will have to choose. Healthcare or food.
People will have to choose healthcare or food. People will have to choose healthcare or food. People will have to choose.
I got something to say about that. Milwaukee, Wisconsin, has been identified as being in the top 10 cities in the country that has suffered the most from the increases in inflation around food. It's true. So we may not even have a choice here. The inflation for food costs in Milwaukee, Wisconsin, are in the top 10 cities in the United States of America. Thank you, sister, for bringing that up.
Amen.
So I just want to say we're all in this together. You know, this administration has been genius at dividing us.
We're not gonna let them.
And I am old enough to remember when we won. We won because we all stuck together.
There you go.
It was not black against white.
Can't eat racism.
LGBTQ against the, no. We are all in the, everybody. This is what we all have in common. We all need health care. Everybody's health care is evidence.
So,
When American people are under attack, what do?
Stand up, fight back.
When American people are under attack, what do?
Stand up, fight back.
What do?
Stand up, fight back.
What do?
Stand up, fight back.
That's right.
so listen, this is just a start, everybody.
We starting it
And
right.
next time we gather, man, bring somebody with you. Oh yeah, remember, No King's Day is next Saturday.
11 o'clock.
Now that should be thousands and thousands of us out here. Millions. We gotta be here. We gotta stand up. We gotta take care of each other. The Calvary's not coming. We are the Calvary. I don't know where it's gonna be.
Cathedral Square.
Cathedral Square,
11 a.m.
11 a.m. No King's Day. Cathedral Square, 11 a.m. next Saturday, the 18th. I want to thank you all for being here. Soldiers, you're leaders. We have to lead. We have to be an example. I remember, and I always like to say this, and I'm done, but when I was young, I used to live around the corner from the Panther Party. And I read that book, Revolutionary Suicide, and one of the quotes I'll never forget. Those of us who refuse to live under oppression and the threat to our existence are dangerous to this society. Because we become symbols of hope to our brothers and sisters, inspiring them to follow our example. Let's be that hope that our brothers and sisters can follow, and we can stand up and fight for our rights. Let's give us a great big hand, everybody. Give us a great big hand. Thank you so much.
Say it with me. It is my duty to fight.
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 It is my duty to win.
It is my duty to win.
That's right. Make some noise for yourself.
Go back to get her. You just come up today? Yep, just came up today. When did you come? About 4.